Hello, everybody. I'm Andrew Salciunas. You can catch me every single day on 97.5 The Fanatic with Anthony Gargano, 10 to 2. And I have another awesome opportunity to learn more about our health. And I'm joined by Jamie Kasper. She's a gastroenterologist. She's a part of the Virtua GI and Digestive Health Group. And it is the month of April. And April is IBS Awareness Health. So I want to talk to Jamie today about IBS. So IBS Awareness Month in the month of April. Jamie, thank you for joining us today, and let's talk about it. Can you please tell us a little bit more about IBS, which is also known as irritable bowel syndrome? What causes it?
Nobody really knows the cause of it. It's not something that there's underlying pathology to it. It's a functional bowel disorder. So if you look at the colon, there's no specific abnormality of it. It reacts abnormally. So nobody really knows what causes it. There's a lot of food intolerances. Sometimes a virus can set it off or another bacterial illness, and it's a post-infectious IBS. Sometimes patients just have heightened awareness of their bowel function, and it's just a hyperacuity. Sometimes it can occur with hormonal changes, especially in women at certain times of the month for them. So there's not really an underlying cause. It can occur at any time. Doesn't have to be there from birth. It can occur later on in life and sometimes even in advanced life.
Now, let me ask you, because whenever we have something going on with our bodies, I feel like we always try to sit down and think, all right, what am I doing that could be hurting me? And one of the number one causes of things is alcohol. So let me ask you, how does alcohol affect IBS?
There's several ways it actually affects it. For the most part, it causes a increase in peristalsis, an increase in motility. So patients will get abdominal cramps, they'll get diarrhea. Just had a patient yesterday who told me that, every time she had alcohol, she would have abdominal pain, bloating, and diarrhea. She cut out alcohol, and lo and behold, her symptoms went away. It can also be related to things that you're mixing the alcohol with. Sodas, seltzers, those things can also cause other symptoms.
So other than trying to cut out alcohol or soda, like you just mentioned, are there any other ways that we can, cope or try to treat our IBS?
A lot of times I'll ask my patients to keep food diaries. It's hard to recall what you're bothered by. So if you write down for a couple weeks what you're doing, what you're eating, what you're drinking, and then you can mark whenever you're having symptoms, and sometimes that can be very helpful in finding patterns. There are certain things that definitely have been proven to cause a lot of GI symptoms. Patients who, a lot of patients are dairy intolerant. Dairy can cause bloating, cramping, diarrhea. Some patients get constipation. There's other patients who are gluten sensitive, who don't have celiac sprue, but find that cutting out gluten definitely causes an improvement of their symptoms. A lot of times I'll have patients try a diet called low FODMAP diet. It's a big amount of words, actually stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Really, they're short chain carbohydrates. So those things can cause bloating, cramping, diarrhea, and cutting those things out can be very helpful. And those include onions, garlic, broccoli, cauliflower, beans, things that patients typically complain about.
Now we're speaking with Jamie Kasper, a great gastroenterologist at Virtua Health. So let me ask you, because I know I'm a victim of doing this. I do it to myself, and I know I'm not the only person in the world to do this. I put off a lot of stuff, especially when it comes to my health. I put off going to see the doctor. When is the right time to go see somebody like you to check out if I have IBS or if I'm just dealing with some other kind of issues?
Well, a lot of patients will diagnose themselves and treat themselves and find what causes their problems and cut those things out, and they feel fine. Patients who really should come see a doctor are number one, patients who have what we call alarm symptoms. So patients who have unexplained weight loss, rectal bleeding, things that you can't explain by just being IBS, and you're worried about other diseases. Also, I would recommend patients over the age of 45 to come for colon cancer screening, because that's the time to get them in. Also, patients who it's affecting their ADLs, it's affecting what they do every day, it's affecting their work schedule, it's affecting their social schedule. They won't go out to eat, they won't go on vacation, they're having difficulties at work, having difficulties at school. The goal that I always tell patients is my goal is to get your symptoms under control enough that you can live the life that you want to live. And that's our goal.
Now, Jamie, last question from me. We all deal with it. We all know stress. We all know anxiety. Is there anything that stress can cause when it comes to IBS?
Yes, stress kind of ramps up your symptoms, not only your awareness to symptoms, but the production of symptoms. It can increase motility. Patients will get more diarrhea, abdominal pain. They can get more bloating. So there's a lot of ways to deal with that, and it certainly has been worse during COVID. I've noticed the past 2 years, patients have a lot more symptoms due to anxiety and the unknown. So a lot of times I will recommend that patients do things to relieve stress, like meditation, yoga, mindfulness. Sometimes we'll use low dose of antidepressants, which also help with visceral pain. So there are a lot of ways to deal with that, and just, you can just take 5 minutes out of your day and, try to, go from head to toe and relieve your stress. And it can really relieve the symptoms a lot. And some patients will have, see therapists to help with the anxiety also.
All right. Jamie, I really appreciate you joining me, especially as it is April, and that means it's IBS Awareness Month. I learned a lot today, and if you watching learned a lot but want to learn more, you can check it out at virtua.org/gut health. That's for more information, and you can schedule a consult with a Virtua gastroenterologist. So you can do a lot at virtua.org/gut health. And again, I learned a lot today, Jamie. I appreciate you taking the time with us.
Thank you.